Have I ever told you it's never too late to heal from pain?
There's no limit to how much better you can get. No one has the authority to tell you you're stuck living this way.
Even chronic disabling pain?
But I find myself not doing things that I used to do because it hurts.
And even when surgery has failed you?
It sounds like you never really felt like you were better from it. I mean, some people
Never,
say, right.
never. So I was using a crutch.
You were walking with a crutch.
Yes.
Well, she and I are here to tell you it's true.
I was in bad shape the first time I came in here.
What are you going to do with your new healed body?
I'll start walking again. 90% better. I'm like at
Okay.
97, 98.
So, what happened? How did we do it? How hard was it? And most importantly, could it happen for you?
I brought this, I don't know if you're interested or not. It's from the orthopedic.
It began with a rather uncomplimentary report from the orthopedic surgeon.
He said you're old. He said, no.
Yeah.
She had moderate to severe degeneration of her hip joint. Physical therapy had failed, injections had failed. So, the surgeon decided the next step was to replace her joint. That may seem logical, but there's some discrepancy here. That's not the hip joint, that's soft tissue, particularly muscle, tendon, and bursa. That does not mean the hip joint was unrelated, but it should have given the surgeon pause to ask what else could be contributing to her pain? What else is going on here?
First thing in the morning, is it stiff and sore or not bad?
It is. It's still sore.
You don't have to be an expert to realize muscles are a key part of this.
Yeah, because the other night I actually had my husband go out in the garage. We have a pair of crutches hanging out in the garage. I said, you've got to go get me a crutch. I can't even walk without.
Listen to her symptoms and then imagine what the muscles are doing. Imagine how they're trying to move her degenerated joint.
Had that click when I would walk. I'd stand up and I have to wait for it to click before I could take a step.
You might be forgiven for thinking the hip joint was responsible for that clicking, but that's not how it works. That's a muscular symptom. Ignoring or misinterpreting it could result in a bad surgery.
These should just be tender. They should not be sharp. Probably going to have some pain like in there.
Oh, yeah.
That's going to keep you contracted. This is part of the VIP experience of the one-shot cure.
Yeah.
You get to feel more pain
So my
leave your body.
He says, right before I left, he said, well, is it going to hurt? I said, oh, yeah. Oh, yeah. It's going to hurt, but it'll be better.
Her hip was full of contracted muscle strain, so of course it hurt. But that's the point. The pain was coming from muscle, not the joint.
Oh, yeah. You felt, now. That right there, you feel me rolling over that snappy band. That's that muscle.
This is iliopsoas, one of the most powerful hip muscles. It lies directly on top of the hip joint. So do you think perhaps it had been roped into compensating for her hip for years? Maybe overcompensating? But it gets a little more complicated because she has severe degeneration of her lumbar spine, and that has profound interactions with her hip symptoms. So the surgeon not only wants to replace her hip, but then he wants her to go on and have major back surgery.
I'm not really concerned about my back. I can deal with my back. It's the hip I can't deal with.
In this moment, my goal is to save her from hip surgery, but there's much more at stake here. And it gets more interesting, because when I check the area of her symptoms, there's hardly any pain.
You're passing there. That's like a A minus. Like, I mean, that's really...
So where do you think her pain is truly coming from? We're getting warmer. Well, not me, not right now, but back then we could both feel it. We were getting close. And there it is. But wait, the back of her knee, how could that be causing her hip pain?
Truly the key pain in your body.
It's warm in here.
Contracted muscle strains like these are hard to work through for both of us. She had been limping around these for years. As rough as it is, when things start to make sense, when patients start to realize what's going on and they feel like they're getting somewhere, it's all worth it. They start to see the light at the end of the tunnel.
What are you going to do with your new healed body?
Oh, start walking again.
Does this sound familiar? That walking would be a dream come true?
Playing more with my grandkids. We went to a concert in the park last night, and my little granddaughter said, come on, Grandma, run with me. I'll walk with you. And we walked a little bit, but I find myself not doing things that I used to do because it hurts.
Do you know that feeling? Having someone you love who makes you want to feel young again. That dream is worth fighting for.
Well, baby plants hard.
I hope I don't kick you.
I hope not either, but I'm calling for help. You do.
I'll try not to.
The presence of so many muscle strains should have given her surgeon pause. The idea that he could perform a surgery and expect a good outcome with all of this present. It's obvious to me, but it's not something we're trained to look at. It's been in front of us the whole time. It's fundamental anatomy, but it's new. And anything new can have unexpected hazards.
Sorry, you kicked me.
I'm sorry.
You hit my elbow.
Okay, I think I deserved it, but my shirt was innocent.
Well, actually, I already had to tear the elbow back and blame you now because that's how you hit me.
So what do you think is primary here? A hip joint that hardly hurt to touch, snapping muscles and tendons, a bursa that was not inflamed, or this nugget of terrible pain behind her knee that made her kick her own doctor?
This is some fire in your body.
Pain is fire. And I can use a little right now. So, having healed the most primary causes of her pain, I declared her cured, or close to it. Overall, I felt pretty confident. Well, confident and slightly wounded.
Sorry, I kicked you. Didn't mean to.
Listen, now I gotta file a work comp claim. I gotta go home early.
So, let's summarize this for a moment. This woman is being offered a total hip replacement surgery, and I treat her one time and tell her she's cured now? Okay.
I don't feel the pain in the side right now. I don't feel any pain right now.
Well, I thought I got it all, or at least enough. It was the best relief she ever had. I told her to come back in 6 to 8 weeks to prove the cure, or to see what we missed. But silence speaks louder than words. She never came back. That meant she was cured, right? I finally called her. She wasn't better. And she wouldn't come back because, in her words, it didn't help. So I asked her, I'm not saying I begged, but I said, things are different now. I have a plan.
So welcome back.
Thanks.
Excited about the chance to really reset you
I
today.
am too.
It turns out that just a few weeks after seeing me, she let the surgeon replace her hip. I failed her. It was entirely my failure.
So tell me, what did you feel like after that surgery?
Not better.
And this is exactly what I was afraid of.
I still feel pain right in this area.
Okay.
Right here.
Got it.
And that's where the incision is, right here.
Oh,
Does
good.
that spot look familiar? Well, now it's worse than ever because those tissues have been cut.
So stairs are very hard for you.
Very,
So if we can make stairs be not daunting to you, what about standing for long periods?
Oh, no, that's hard too.
Like dishes
Yeah.
or in the store?
Yeah.
About how many minutes do you think you can stand for?
Well, 10, 15.
okay. Then
but
it runs out. But
yeah,
Okay.
I should be able to stand hours.
Yeah. So,
There's a lot that I haven't done,
okay.
like
Because-
yard work and things
because you-
because of
yeah,
that,
okay.
because I
So we
think
wanna get
it's
some-
going to be hard.
Surgery did not help her pain, and even worse, it did nothing to help her function.
It sounds like you never really felt like you were better from it. I mean, some people
Never,
say, right.
never.
So, I say wrong diagnosis, wrong treatment. I'm going to try to prove it to you.
I was all in. This was a redemption round, and she had nothing more to lose. We both had a second chance because it is never too late to heal. Since she left, I thought of her every time I healed someone's hip. I kept getting better and better. So when she came back in, I was ready. This was going to be a one-shot cure. Redo.
There is no boundary. This really is a frontier. There's no limit to how much better you can get. No one has the authority to tell you you're stuck living this way.
Yeah.
And I'm here to tell you
Yeah.
you're not stuck living this way.
Good.
This time things were different. She was different. She had been permanently altered by surgery. And I was different, better. But was I better enough to do what I could not before? And what about her treatment last year? Was it all for nothing?
You remember how it was when I first started?
Oh, yeah.
Here was the first pressure I put in was about like this, and it's already softer. That knottedness is way down, not gone, but way down.
It still hurts, but it is better.
Yeah, good.
Now, this is huge. The things we treated almost a year ago were still better. And that's exactly as it should be, because this is part of the proof that releasing contracted muscle strains is an essentially permanent healing. All of this was possible from 4 simple steps: listening, looking, finding, and fixing. It is the strongest, most genuine relationship I can have with my patients, to understand the truth of their suffering and to feel it with them. And it can only be done by hand.
And they certainly never looked. But they found cysts or bone on bone, so they go to operate.
He never put his hands on me. He never touched me.
The surgeon never touched you. He had gloves and a scalpel.
Yeah.
He never touched you.
What terrible harm could have been avoided if he had? Well, he hadn't, so here we are. Better late than never. And it's never too late.
Okay, we got a lot of that.
That's a lot. That was a lot.
I was going to get it right this time. Knowing what I know now, I can see I didn't get it all before. Frankly, who could blame me? I was dodging kicks left and right, a little distracted, and be honest, don't I look a little gun-shy even now?
Oh.
Yeah, there it is, darling.
I knew we were healing her because, remember what I told you? Pain is fire.
Phew, I think it raised about 10 degrees in here.
Yeah, that's right.
And so, we put the fire out.
It'll be a fascinating proof when you are healed and can walk and stand and do stairs better.
I really think we got it this time.
Okay, thank you very much.
Yeah.
I go home and laugh about it now.
Yeah, that's right.
Bye.
Yeah.
So I brought her back 6 weeks later. And what do you think she said?
Well, what's the good or bad word here?
90% better.
Well, that's really good.
Yeah, probably. If
Okay,
I
come
would've-
up, see
up here.
Yeah.
Probably if I'd been doing my exercises every day instead of once a week.
90% better. And without even doing her homework. Would you like an A- without having to do homework?
But I am better, and I'm so happy about it.
That's awesome. Perfect.
Yes.
That's what we wanted to see.
I think the exercises, I really do.
That'll help it.
That
Okay.
helps so much.
Well,
yes.
considering you're only doing them part time,
I know.
that's a short hour
I've got
position, really.
a goal
Okay.
to take care of myself better. So
That's a good goal. So even just watching you walking,
yeah,
that was a normaler
yeah.
walk.
Sometimes you have to make up new words to describe just how good a patient is.
What do you still notice is hardest? Walking
Stairs.
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 Yeah.
definitely.
And
Stairs.
where do you feel
Here.
it? Right there.
Right here.
Okay.
Yeah.
Anything else new or different? What else is on your mind here?
No, I can deal with it.
Okay.
I can deal with it all.
So,
yeah,
let's-
it's so much better.
Yeah. Awesome.
It wasn't time to celebrate yet, not for me. Instead, I was feeling mostly curious. Was she really better after what we had done? Was she really cured? I had to look at the objective evidence.
So far, this is a passing score, man. It's
It
not.
just doesn't even hurt.
Yeah, it's really not that bad.
I think I feel better and less pain if I do the exercises than if I just go out for a walk.
Yeah.
Visger sizing only once a week got her this far. Imagine if she were Visger sizing every day.
That's not near as sore as it was last time.
Now here's the true test. Returning to the scene of the crime. Can I apply the same pressure and not get kicked? Drum roll, please.
A little more scrutiny behind the knee here.
Success. Now, hear the hope in her voice.
So how confident are you that you're gonna?
I am.
Keep
I'm
me
very
good.
confident.
Yeah.
Yeah, I am. I'm very motivated. I'm excited about maybe for line dancing again in Florida this year.
There
Couldn't
you
do
go.
any of it last year, so.
Well, that's what one shock cure is supposed to be. 90% man for single treatment. So I'm optimistic now, and now she's clearly better. Good. Let's just keep it there.
So, do you think she was really cured? Is 6 weeks of 90% relief enough to prove that to you? That what happened was real healing, not temporary, but curative? If not 6 weeks, then what? How about 22 weeks?
Watching you walk, you're walking pretty quick.
Yeah, I'm doing pretty good.
That's good. It's been about 5 months since I saw you last. It was July. I saw you last. I don't know if you said it was 80 or 90% better or whatever. At the time.
Yeah, it was like 90. I think I'm
90?
like at
Okay.
97, 98.
Yeah,
Yeah,
that's
I
awesome.
think so. Climbing the stairs is easier. Walking is definitely easier. Yeah, so much better. Pain of it isn't there. anymore. So it's
Yeah.
better the more I do. The more I walk, the more I do.
Perfect.
Yeah, it's better.
You heard it. That is hope. That is healing.
We're leaving January 11th, so
Okay.
we'll get down there and I'll get walking and swimming and
Perfect.
get some weight.
Fine.
Otherwise, I don't have any major complaints. I don't have any major pains. I think I'm almost cured.
Yeah, you are. You're 90. You're
Yeah.
you're almost there.
Excellent. But words are not enough. We have to put the cure to the test.
So far, this is feeling really easy. Like
Yeah.
I can go like 3 or 4 inches in.
Just about send me to the ceiling before.
Yeah, I can go all the way in here. There's no bite. There's no spasm. There's no inflammation. I'm gonna follow it down lower in the hip and pelvis, but this is really good.
Everything was vastly improved. The only pains that remained were shadows in the deepest recesses.
Yeah, I got that
That's
really
a
good.
lot better.
There is much yet that time and good living can heal.
I say, you are cured.
Done.
You pass. You
Good.
graduate.
Good. Good.
Okay.
She has the tools. She has a desire. Nothing is in her way now.
Okay,
Sounds good.
Great.
Sounds like a great plan.
Well,
yes. Thank you.
Do you like handshakes, high fives, or fist bumps? All right.
All
Great.
right.
Good work. No more. How about no more surgeries?
Yeah, that's gonna say if this hip starts hurting, I'm coming back
Okay.
before I do anything.
That's right. Have a great time down
I
there.
will. I will. All right.
Yep.
Thank you. Happy holidays.
Thank you. Look at that. I'm cured. Still cured. 5 months later. Still cured. Actually, more cured. She was 90% better. She's 97 or 98% better now. That's really cured. And she's launching to a new chapter of health, of wellness, and avoiding other doctors. Let's call that a good day's work.
What he said. I failed her the first time, but I found what I had missed. If you're a provider, then you should already know it's never too late to learn. And if you or someone you love is in pain, don't give up. There is a light. I'm Dr. Benjamin Visger, and I'll see you at the end of the tunnel. Let's go. So here's the irony. She said she's flying down to Florida on January 11th. It's January 10th today. And so, boy, she's probably looking at this and thinking, I can't wait to get on that plane. And me, I'm thinking, there's nowhere I'd rather be.